The blood hit the floor before anyone moved. A man was dying 12 feet from the nurse's station, his artery opened like a split hose, and not one person in that emergency room had the nerve to touch him. Monitors screaming, staff backing against the walls. A trauma physician with 17 years of experience stood frozen with his gloves on and his hand shaking. And then she walked past all of them. No announcement, no permission asked. Just a woman in worn scrubs who dropped to her knees in the blood and forced her hand inside a stranger's chest cavity like she'd done it 100 times before. Because she had. They didn't know that yet. They thought she was nobody. That was their first mistake. And before this night was over, it would destroy them. If this story has your attention already, stay with me until the very end. Hit like, drop a comment with the city you're watching from. I want to see how far this story travels. The city of Harrow Falls, Montana sat wedged between two mountain ranges and one very bad idea. The Belcourt Chemical Processing Facility, which had been operating at the edge of legal compliance for 11 years, and everyone in town knew it, and nobody said anything because it employed 400 people and the economy was thin. Harrow Falls Regional Medical Center wasn't a trauma center by design. It had become one by necessity, absorbing the accidents and injuries that came naturally when you built a chemical plant 14 miles from the nearest highway and called it Progress. The ER had 32 beds, a staff that rotated too fast, and an equipment budget that the board reviewed every quarter and cut every time. It was not a glamorous place to work. Nurse Serena Voss had understood that going in. She'd taken the position 8 months ago without illusions, signed a 2-year contract, and shown up every shift in the same pair of scrubs she'd owned for 4 years. Dark navy, slightly faded at the knees, unremarkable in every way. She was 34, white, average height, with the kind of face people forgot immediately after meeting her. Brown hair usually pulled back tight, no jewelry, no small talk. She brought her own coffee in a battered thermos, and she drank it at the nurse's station between patient checks, and she did not laugh at the jokes other staff made about the administration or the patients or each other. People decided they didn't like her within the first week. She was cold, according to Paige Denton, the charge nurse who had worked at Harrow Falls Regional for 9 years, and treated that tenure as a form of seniority that entitled her to opinions about everyone. Paige was the kind of person who wore her name badge on a lanyard with a little metal star on it, and she managed the shift schedule with the territorial focus of someone protecting something genuinely important. She doesn't communicate, Paige told Dr. Marcus Holloway during their first month of overlap, standing near the supply closet like she didn't want to be overheard, which meant she absolutely wanted to be overheard. She just does things without asking. It makes the team uncomfortable. Dr. Holloway was the ER's attending physician for night shifts, a tall man in his mid-40s with a forceful voice and the particular confidence of someone who had never been seriously wrong about anything and therefore believed he never would be. He had a habit of addressing nursing staff the way some people address GPS systems, functional tools that occasionally provided useful input and should not deviate from expected behavior. If she's causing workflow problems, document it, he said. I am, Paige said. Serena knew about the documentation. She'd found out through Yolanda Briggs, an ER tech who'd been at the hospital for 3 years, and had decided in month 2 that Serena was either the most competent person in the department or the most dangerous one, and kept watching to figure out which. Yolanda had a habit of mentioning things casually, like side notes, but her eyes always tracked the reaction. Paige wrote you up for the Harris case, Yolanda said one evening, not looking up from restocking a cabinet. Said you overstepped scope of practice. Serena was charting. She didn't stop. The Harris case, where the patient's oxygen sat dropped to 81 and nobody was responding? That one. Okay. Yolanda waited. That's it? Okay. What else should I say? Yolanda closed the cabinet. Most people would be upset. Most people weren't watching an 81 sat while someone debated whose responsibility it was. Serena saved her chart. I documented my interventions. The patient's fine. If Paige wants to write something up, she can write something up. Yolanda didn't say anything for a moment. Then, where did you work before here? Different places. Like where? Serena looked at her. Not unfriendly, just even. Why? Yolanda shrugged one shoulder. Because you don't act like someone who learned nursing in a regular hospital. There was a pause, and then the radio crackled with a call from triage, and the conversation ended the way most conversations with Serena ended, in motion, with something more urgent taking over. The thing about Harrow Falls Regional was that it ran on a particular social structure that everyone understood but nobody named. Dr. Holloway was at the top because he was the attending and because his voice carried and because he'd once successfully sued a former employer for wrongful termination, and people were aware of that. Paige held the middle layer, maintaining it through information. She knew everyone's evaluations, everyone's incident reports, and she deployed that knowledge the way a person plays cards, carefully and at the right moment. Below that were nurses organized informally by seniority and specialization, and below that were the techs, and everyone knew their place and stayed in it, and the system held. Serena didn't fit anywhere in it. She was too senior in manner to be dismissed as new, too quiet to be socially relevant, and too technically competent in ways that made people uneasy. The way someone becomes uneasy when they realize they can't quite identify the source of something's skill. Dr. Holloway noticed it first in the third month, during a shift where a motorcyclist came in with a tension pneumothorax that his resident had missed on initial assessment. Serena was at the bedside before the attending was called. She hadn't treated the patient, she was too careful for that, but she had positioned him, identified the breath sounds, and had a decompression needle in her hand when Holloway walked through the curtain. He looked at the needle, looked at her. "What do you think you're doing?" "Anticipating," she said. She handed him the needle. "The trachea's deviated, right side. You'll want a 14 gauge. It was a 14 gauge. He used it. The patient stabilized. Afterward, Holloway didn't say anything to her. But she saw the way he watched her for the rest of the shift, something between professional respect and personal irritation, which was an uncomfortable combination, and apparently he'd resolved it by choosing the irritation. "She had a needle prepped before I assessed the patient," he told Paige, according to Yolanda, who had heard it through the supply room wall. "That's not appropriate. That's not her role." "I'll document it," Paige said. "Please." And so it continued. Every incident in which Serena performed well-generated documentation about her performance being a problem. It was the kind of institutional logic that ran on its own momentum. Once the narrative was established, evidence to the contrary became evidence of arrogance or aggression rather than competence. And the people maintaining the narrative didn't have to consciously lie because they'd already decided what the truth was. Serena understood exactly what was happening. She'd encountered versions of it before, in different settings, with different faces and different roles, and she had learned a long time ago that fighting the narrative directly was usually a waste of time. You couldn't argue someone out of a position they hadn't reasoned themselves into. So she kept coming to work. She kept doing her job. She kept her charting meticulous, and her interventions documented and her communication logged. She was building something, quietly, the way a person builds anything that needs to last. One layer at a time, without announcing it. What she did not do, ever, was explain herself. That quality, more than anything, drove Paige absolutely insane. The night the shift changed was a Tuesday in October, cold outside in the particular way Montana gets cold. Not theatrical, just total, like the air has simply decided it's done pretending. Serena was 40 minutes into a 12-hour shift when Paige appeared at the nurse's station with a folder and a specific expression, the one that meant the documentation had arrived at its destination. "Administration wants to meet with you," Paige said. She didn't say it quietly. Yolanda, nearby, stopped moving. "When?" Serena asked. "End of shift. Harris wants you in his office at 6 a.m. Curtis Harris was the hospital administrator, a compact man in his 50s who wore pressed shirts and spoke in the measured cadences of someone who had been to a management seminar in the last 18 months. He was not unkind exactly, but he operated from institutional self-protection, which meant that when a narrative reached his level, it had usually already hardened into policy. "What's the meeting about?" Serena asked. Paige looked at her folder. "He'll explain it. You could just tell me." "He'll explain it," Paige repeated, and there was something in her voice, a small, satisfied weight, that told Serena the folder contained more than she'd expected. She nodded once. "All right." Paige left. Yolanda waited until she was around the corner and then said, very quietly, "Serena, I know. They're stacking it. I know. 3 write-ups in the last 6 weeks. Holloway's name is on all of them." Serena looked at her. "How do you know that?" Yolanda's expression said she wasn't going to explain her information network. "You need to go in there with something. You can't just walk in quiet and expect it to go well." "I've handled this before." "Have you?" There was a pause. Outside, wind hit the building with enough force to make the overhead lights flicker once, a brief hesitation, and then steady again. "Yeah," Serena said. "I have." She picked up her next chart and walked down the hall. The shift ran long because shifts always ran long. By 3 in the morning, they had 14 patients in a department meant to hold 12, a drunk driving victim with a shattered pelvis who needed orthopedic surgery they couldn't do in-house, and a 7-year-old brought in by parents who'd driven 2 hours from a rural community because their family doctor was on vacation and they had no other option. The 7-year-old had croup and was terrified, and Serena spent 20 minutes with her, sitting on the edge of the bed, speaking in a low, steady voice about the cool mist mask and what it would feel like, not explaining the medicine in words designed for parents, but in words designed for a scared child. And the girl eventually stopped crying and started breathing more slowly, and her mother, watching, had to look away at the ceiling for a moment. "You're good with kids," the mother said afterward, when the girl had fallen asleep. "She was brave," Serena said. "She meant it. Do you have any?" Serena's hand stilled for a fraction of a second on the chart. "No." "You have the patience for it." Serena smiled. Not a wide smile, but real. "That's a kind thing to say." She walked out of the room, and her face went neutral again, and Yolanda, who saw her in the hall, made a mental note of the 2 seconds between the curtain closing and the expression changing, filed it away with all the other things she'd filed, and said nothing. By 4:30, they'd moved the pelvis patient and the croup case had stabilized, and the ER was in that strange quiet that comes in the dead hours. Not peaceful exactly, just waiting. Holloway was in his office. Paige had gone on break. 2 other nurses were charting at the far end of the station. Serena was checking vitals on a chest pain patient in Bay 6 when she heard it, not an alarm. Something before the alarm. A change in the quality of the noise outside. Something that had been low and distant and was now getting closer and taking on a new character. She finished the blood pressure check, made a note, and walked to the bay window that looked out toward the ambulance bay. The sky to the northwest had a color in it that didn't belong. Orange. Brick orange, low and spreading, the kind of color that means something is burning that is very large. She stood at the window for 5 seconds. Then she walked directly to the charge desk and picked up the radio. "This is Harrow Falls Regional ER. Anyone on county emergency frequency? What's happening at Belcourt?" Static. Then a dispatcher's voice, strained and too fast. "All medical facilities on standby. Belcourt Chemical has a Level 3 event in progress. Multiple confirmed casualties. EMS responding now. Expect incoming." She set the radio down. "Yolanda." She said it once, clearly, not loudly. Yolanda looked up from across the room. "Get Holloway. Get Paige. Start pulling MCI protocol. We have maybe 12 minutes. Yolanda's eyes went to the window, to the orange horizon, and then back to Serena, and she was already moving before Serena finished the sentence. Mass casualty protocol at a small regional ER is an exercise in organized chaos. There is a plan. The plan has been practiced, and in actual practice, approximately 60% of it survives contact with reality. The rest is improvisation, which means it falls to whoever is clearest under pressure, and in the next 11 minutes, as the hospital shifted from night quiet to full emergency footing, it became obvious to everyone watching that Serena Voss was clearer under pressure than anyone else in the building. She wasn't loud about it. She didn't take charge in any official sense. She was too careful for that, and she understood what happened when nurses overstepped their documented scope at a facility that was already building a case against them. But she positioned herself at the nexus of the preparation, and the questions started coming to her because she was answering them faster than anyone else. Where do we stage the overflow? Pull the curtains in Bay 10 and 11. Create a secondary triage zone. Label it. We don't have enough burn supplies for a large event. I know. Call St. Catherine's in Billings and get a transfer protocol started now, before we know who needs it. It takes 40 minutes to arrange, and we won't have 40 minutes. Holloway wants the trauma bay cleared. It should be cleared. Tell him I agree. Paige appeared at her shoulder. Who authorized you to, Paige? Serena looked at her once. The ambulances are 90 seconds out. What do you need from me right now that isn't this? Paige's mouth opened, closed. The radio crackled. Harrow Falls Regional, first unit inbound, 3 critical, 2 serious, chemical exposure combined with blast injury. ETA 60 seconds. And then the ambulance bay doors burst open and everything became very loud. The first patient was a man in his 40s, a plant worker named, according to the paramedics' report, Dalton, who had been closest to the initial blast. His left arm was gone below the elbow. He'd been tourniqueted in the field, the paramedic had done it correctly, but he'd lost blood and was hypotensive, and his skin had the particular gray-yellow tone of someone whose body had already started its own emergency shutdown protocol. Holloway was at the bay when they wheeled him in. His resident, a second-year named Tate, was at his shoulder. The team moved around the patient with trained efficiency. IVs going in, monitors connecting, the controlled noise of a trauma resuscitation. Serena was in the secondary triage zone managing the second wave. Then she heard Tate's voice crack. Dr. Holloway, his pressure's not responding. We've got massive transfusions started, but adjust the vasopressors. I did. It's not. The monitor in Bay 1 alarmed. Long, flat. Serena was moving before she decided to move. She came through the curtain and read the room in the first half second. The patient crashing, Tate frozen with his hands half raised, Holloway barking orders at a team that was executing them but getting nowhere, and a very specific pattern in the monitor that told her what was happening before any of the blood work came back. Cardiac tamponade. Blood in the pericardium, compressing the heart, and nobody had caught it because nobody had been thinking about it, and the blast injury to the chest was subtle, not dramatic, easily missed, easily attributed to the hypotension that was already explained by the arm. She didn't announce it. She picked up the ultrasound probe from the machine beside the bed and pressed it to the patient's chest and turned the screen so Holloway could see it. He looked at it. Yes, she said. We need a pericardiocentesis. Yes. That's a physician. I know what it is. She held the probe steady. I'm showing you where to go. He stared at her for 1 second, 2, and then he took the needle from the tray she'd already positioned, and he did the procedure, and he drained the fluid, and the monitor climbed from flat to chaotic to rhythmic over the course of about 90 seconds. And Dalton, the plant worker, came back from wherever he'd been going. Nice catch, Tate said quietly, not to Holloway. Holloway heard it. He didn't say anything. Serena handed off the ultrasound to a tech and went back to triage. The next 2 hours were the kind of hours that become mythology in small hospitals, the ones that get told at retirement parties and staff meetings for years afterward, calibrated differently each time depending on who's telling them. By the end, they had treated 19 casualties from the Belcourt event. 3 had been transferred to Billings. 2 had required surgical intervention that pushed the on-call surgeon to his limits. 1 had died on arrival, and there was nothing to be done about that. The rest had survived. Paige found Serena in the supply room at 6:15, restocking, because the meeting with Harris had technically been scheduled for 6, and nobody had rescheduled it. Curtis still wants to see you, Paige said. Serena looked at the shelf in front of her. She was counting gauze packages. Right now? He's been in his office since 5:30. Okay? She finished the count, wrote it down, set down the clipboard, and turned around. Let's go. Harris's office was on the 2nd floor, a small room with a view of the parking structure and a desk that had too many papers on it. He was behind it when they came in, Paige sitting to the side, which Serena noted, which meant this was structured as a formal meeting with a witness, which told her the documentation had indeed moved where she'd suspected. Nurse Voss, Harris said. Sit down. She sat. I want to talk to you about the pattern of incidents that have been brought to my attention over the last several months. He had a folder too, same as Paige's, and he opened it with the methodical energy of a man who had prepared this conversation and intended to follow his notes. 3 documented incidents of scope of practice violations. 2 formal complaints from Dr. Holloway regarding insubordination. 1 complaint from... "Can I ask you something?" Serena said. Harris stopped. "Before you continue, can I ask you one question?" He paused. "Go ahead." "In the last 2 hours, the Belcourt event, were there any patient deaths that you believe were preventable?" Harris looked at Paige, back to Serena. "I haven't been fully briefed on 19 casualties," Serena said. 1 DOA, which was not survivable at presentation. 18 treated and stabilized. 3 transfers to Billings for higher-level care, all of whom are stable. Nobody else died, Mr. Harris. On a night when your ER was hit with a mass casualty event and you had no trauma surgeon on site and your attending physician..." She stopped, chose her next words. "On a night with those conditions, nobody died who could have been saved." The room was quiet for a moment. "That doesn't change the..." "I know," she said. "I know it doesn't change the documented complaints. I'm not arguing that it does. I just want you to have the full picture when you make your decision." Harris looked at her. She could see him running through something in his head, the folder, the events of the last 2 hours, whatever version of this conversation he'd rehearsed. "Nurse Voss," he said finally, "effective today, I'm placing you on administrative suspension pending a formal review. I need your badge." Serena looked at him for a long moment. Then she reached to her lanyard and unclipped her badge and set it on the desk. It made a small, flat sound in the quiet room. "I'd like the review timeline in writing," she said. "You'll receive it. And the specific policy citations for each violation. Also in writing." She stood. "Thank you for telling me directly." She walked to the door. Paige was watching her with something that looked like anticipation, waiting for the outburst maybe, or the tears, or whatever reaction she'd been expecting from a person finally broken down. Serena paused in the doorway. "For what it's worth," she said, "the patient in Bay 1, Dalton, the one with the tamponade, he would have been dead in 4 minutes if someone hadn't caught it." She looked at Paige specifically, not Harris. "Write that in your folder." She walked out. The locker room was empty. She changed out of her scrubs in silence, folded them, and put on the civilian clothes she'd driven in wearing, jeans, a gray Henley, a jacket that had seen better days. She sat for a moment on the bench with her hands resting on her knees. Her phone had a text from Yolanda. "I heard. I'm sorry. That was wrong." She typed back, "I know. Thank you." She sat there a while longer than she needed to. Not because she was devastated, she'd known this was coming, had watched it building for weeks with the detached recognition of someone watching a storm form on a horizon they've seen before. She sat because she was tired. Not tired of the work, never that. Just tired of the particular toll of being very good at something in a room full of people who decided you weren't. Outside, Harrow Falls was getting its first light, gray and slow, coming over the eastern range, the mountains turning from black silhouettes to shapes with texture and depth. She could see the faint residue of smoke still in the northwest sky from the Belcourt facility. She picked up her bag, put on her jacket. She was almost to the door when she heard it, distant, coming from the direction of the ambulance bay, a sound that cut through the quiet of the early morning with the specific authority of something that does not ask for clearance before arriving. She stopped, stood very still. Because she knew that sound, she'd heard it in 6 different countries. She'd learned to assess wind direction and landing zone clearance by it. She'd run toward it when other people ran away from it. The low, unmistakable, rhythmic percussion of helicopter rotors, and not a standard air ambulance. The acoustic signature was different, heavier, faster, military. Her hand was still on the door. From the intercom above her head, the desk paging system clicked on, and a voice came through. The night desk nurse, her voice climbing the register in a way that meant something had just happened that the night desk nurse did not have a protocol for. "All available trauma staff to the ER bay. All available trauma staff. We have military aircraft inbound requesting emergency medical support. Repeat, military aircraft. Trauma staff to the bay immediately." The rotors were getting louder. Serena's hand came off the door handle. She stood in the locker room of the hospital that had just suspended her, holding her bag, listening to a sound that activated something older and deeper than any job title she'd ever held. A trained reflex that had been built over years in places that do not appear on maps that civilians see. And it did not care about administrative suspension or documentation folders or the particular institutional politics of Harrow Falls Regional Medical Center. Her bag went back on the hook. Her jacket came off. She looked at her scrubs, folded on the bench. The rotors outside were so loud now that she could feel them. She put the scrubs back on. It took 45 seconds. She didn't rush. She didn't fumble. She moved with the economy of someone who had dressed for emergencies in darkness, in cold, in conditions that made a clean locker room with fluorescent lighting feel almost absurdly comfortable. The fabric was familiar against her skin. The badge was gone from her lanyard, but the lanyard went back on anyway, a reflex, and she caught herself doing it and left it. She walked out of the locker room and down the hall toward the ER bay. The hospital had changed in the 3 minutes she'd been sitting on that bench. The particular quality of movement had shifted. Staff moving faster, voices sharper, the whole building tightening the way a body tightens when something unexpected has entered its space. She passed 2 orderlies going the opposite direction, and neither of them looked at her, which was fine, which was how she preferred it. The ambulance bay doors were propped open and the cold came through in a solid wave. She stepped into it. The Blackhawk was already on the ground. Not in the designated landing area, there wasn't one large enough, but in the far corner of the parking structure approach, which had been cleared, she assumed, by the helicopter crew themselves because they had not asked for clearance. They had simply chosen the most viable surface within range and put the aircraft down on it. The rotors were still cycling, slower now but still moving, and the downwash made the flags above the entrance horizontal and snapping. 4 men came out of it at a run. Military bearing was a real thing, not a cliché, not a movie convention, but an actual observable quality in how a person's body organizes itself under pressure, a straightness in the spine and a deliberateness in the movement that comes from training so deep it no longer requires thought. All 4 of them had it. They were in field gear, not full combat kit, but the kind of mixed dress that said they'd come from somewhere operational in a hurry and had grabbed what was at hand. 3 of them were running. The 4th was being carried. He was a large man, over 6 feet, broad through the chest, and the 2 operators carrying him were not small men themselves, but they were working for it, and she could see from 40 feet away the source of the difficulty. His left side. Something in his left side that the field dressing wasn't fully addressing, and the way his head was positioned told her he was conscious but marginally. The man at the front, team leader, she assessed, by position and by the way the others oriented to him, hit the ambulance bay door and stopped when he found it blocked by Tate, who had come out ahead of everyone else and who was a second-year resident and who was at this moment visibly not equipped for what he was looking at. "We need a trauma bay," the team leader said. He wasn't shouting, but the voice carried. It was a voice built for noise environments. Yes, okay, come in. We need to get a physician. Is there a physician or not? Dr. Holloway is... Get him! Now!" Tate stepped back. The team came through. Serena was standing to the left of the door, and the team moved past her and she fell in 2 steps behind them, naturally, without announcement, reading the patient as they moved. Left lateral wound, field dressing partially saturated, no tourniquet because you couldn't tourniquet a torso, blood pressure difficult to assess by visual, but the skin color and the respiratory pattern were giving her information. He was breathing on his own, which was something. The rate was wrong, too fast, shallow, the pattern of someone whose lung wasn't fully cooperating. She needed to see the wound. They came into the trauma bay and the 2 carriers got the patient onto the table, and Holloway appeared from somewhere in the back of the ER, still pulling on gloves, and his resident was behind him, and 2 nurses came in, and the bay got crowded fast. Holloway looked at the patient, looked at the team leader. "What happened?" "Training accident, 40 minutes ago. Penetrating injury, left lateral chest wall." "What did it?" A very brief pause. "Metal fragment." Holloway pulled back the field dressing, and Serena, standing at the foot of the bed, saw the wound before he spoke. Entry wound approximately 2 centimeters, irregular edges, left lateral chest wall at roughly the 7th intercostal space. The dressing had been packed correctly. Someone on that helicopter knew what they were doing, but the saturation rate suggested continued bleeding. "We need a chest film," Holloway said. "He doesn't have time for a film," Serena said. The room went still. Holloway turned around slowly. She was supposed to not be here. She was suspended. She had no badge. She had walked back into a room she'd been formally removed from and spoken directly contrary to the attending physician's order in front of a trauma team and 4 armed military personnel. And it was, objectively, the worst professional decision she could make. She held his gaze and said, "His breath sounds are unequal. You can hear it from here if you listen. He's got fluid accumulating, but probably hemothorax, maybe both. A film takes 8 minutes minimum, and he's been hemorrhaging for 40. You need a tube, not a picture." Holloway stared at her. "You're suspended," he said. "I know." "You need to leave this room." "I will," she said. "After." The team leader had been watching this exchange with the particular focused stillness of a man who processes information very quickly and is deciding how to apply it. He looked at Holloway, looked at Serena, looked at his teammate on the table. "Is she right?" he said. To Holloway. Holloway didn't answer immediately. "Is she right?" he said again, and his voice had changed. Quieter, harder, the kind of voice that does not ask things twice as a courtesy. Holloway picked up his stethoscope and leaned over the patient and listened, left side, right side, and his face did something when he heard the difference. A tightening around the eyes that people who knew him would recognize as the moment he found something he hadn't expected and didn't want to have missed. "Get a chest tube tray," he said to the nurse. Serena stepped to the right side of the bed. A chest tube insertion on an alert patient is an intensely physical and sensory procedure. Local anesthetic first, then an incision, then blunt dissection through the chest wall muscle, then the introduction of the tube itself, and when it goes in correctly, there is a rush of fluid or air or both, and the patient's breathing changes in a way that is immediately and viscerally apparent. It is not a clean procedure. It is not supposed to be. Holloway did the procedure. Serena was on the opposite side of the bed managing the patient, keeping him still, which required more than it sounds because the man was large, and despite the pain, he was working very hard not to move, the way trained people sometimes work against their own treatment because their body's threat response has filed the intervention under attack. And she spoke to him the whole time. Low voice, continuous, not comforting exactly, but anchoring, giving him something to follow while the physician worked on his left side. "Stay with me. Breathe out when I tell you. You're doing the right things." His eyes found her face and didn't leave it. "What's your name?" she asked. His jaw tightened. "Reyes." "Okay, Reyes, I need you to breathe out in about 3 seconds. Slow. Let it go." He breathed out. The tube went in. The drainage was immediate and significant. Dark blood, more than she'd hoped for, but not more than she'd prepared for. And the respiratory pattern changed within 30 seconds, evening out, the rate slowing, the effort decreasing as the compressed lung found room to expand. Holloway stepped back. He looked at the drainage collection, looked at his patient, whose color was already beginning to shift back towards something viable. "Get blood running," he said to the nurse, and his voice had a quality in it that was different from 5 minutes ago. A subdued quality, a pulled-back quality, the sound of a man recalibrating something privately. The team leader was at the foot of the bed. He'd been there the whole time, not interfering, not speaking, just watching. He was watching Serena specifically, with an expression she couldn't fully read from her position, something between recognition and something else she didn't have a category for yet. "Reyes," the team leader said. Reyes on the table turned his head. "You good?" A sound that might have been a laugh. "Ask me in 20 minutes. "Yeah?" The team leader looked at Holloway. "What's the prognosis?" "He needs monitoring. The hemothorax is significant. He'll need to stay..." "How long?" "At minimum. Ballpark." Holloway paused, recalibrating to someone who needed operational information, not clinical hedging. 24 hours minimum, 48 is safer." The team leader nodded once. He looked at Serena. "Who are you?" "A nurse," she said. You work here? A beat. Currently unclear. He studied her face with the kind of directness that made most people uncomfortable. She had met people who looked at you that way. Not rudely, not aggressively, but with a precision that meant they were storing what they saw and they were good at that storage. What's your background? Medical. More specific. Why? One of the other operators standing near the door made a small sound. Not quite a laugh. The team leader didn't look at him. He was still looking at her. Because you walked into a room you apparently weren't supposed to be in, and you overruled a physician, and you were right, and I'd like to know where that comes from. The stethoscope, she said. Same place it comes from for anyone. He looked at her for another moment. Then something in his expression settled. Not resolved, just set aside for now. And he turned back to Holloway with a list of questions that were detailed and specific and revealed a level of medical knowledge well above what civilians typically carried. Serena stepped back from the bed. Her hands were steady. They were always steady. She'd stopped noticing it the way you stop noticing things that have been true for long enough. She became aware slowly that Paige was standing in the doorway. Paige had her arms crossed. She had the expression of a person who has just watched a situation develop in a direction they hadn't planned for and is now running rapid calculations about what it means for the plans they have already set in motion. Serena walked toward her. "You're suspended," Paige said, low. "I heard you the first time." "Curtis is going to—" "Can I ask you something?" Serena said. She was close enough now that she could keep her voice down and still be heard. Genuinely. Not as an argument. Are you happy with what just happened in there? The patient outcome. Are you satisfied with that? Paige blinked. It was not the response she'd prepared for. "Because that's what matters to me," Serena said. "The rest of it, the paperwork, the review, whatever Curtis decides, that's going to go the way it goes. But that man on the table is breathing because someone caught what was happening, and I need you to understand that I am not going to apologize for it." Paige's mouth opened. "I'm not telling you that to be difficult. I'm telling you because I think you already know it, and I think knowing it and doing what you're planning to do anyway is going to feel a certain way later, and that's between you and yourself." Serena looked at her steadily. "I'll be in the locker room." She walked past her and down the hall. She didn't look back, and she didn't need to. She could feel the quality of the silence behind her, and that was enough. Curtis Harris found her in the locker room 17 minutes later. He came in and stopped just inside the door. She was sitting on the bench again, same position as before, bag at her feet, hands in her lap. And he looked at her with the expression of a man who has had a difficult half hour and has not yet resolved what he thinks about it. "Dr. Holloway told me what happened," he said. "All right. The patient is stable." "I know." Harris came further into the room and stood near the opposite bench. He was not a man who sat in other people's spaces without being invited. "The military personnel are requesting a briefing. They want to know the full status of their team member. Holloway can give them that. They're asking for you specifically." She looked up. Harris's expression was complicated. The team leader asked the front desk for the nurse. His words were, "the nurse who knew what she was doing." Paige told him your name. He paused. "I don't know what to make of that." "You don't have to make anything of it," Serena said. "I'll go talk to them." "You're still suspended." "I'm aware." She stood up. "Do you want me to talk to them or not?" He looked at her for a long moment. Something was working in him. She could see it, the internal revision of a situation he'd walked into this morning, thinking he understood, and now was not certain he did. She did not push it. She had learned a long time ago that some doors open faster if you waited near them quietly, rather than knocking. "Go talk to them," he said. "After, we'll need to revisit the review." "In writing," she said. "In writing," he agreed. She left the locker room for the third time that morning. The sky outside the window at the end of the hall was fully light now. Gray-white Montana morning, the mountains clear and enormous to the east. The smoke from Belcourt dissipated to a thin smear. Inside the hospital, the night shift's aftermath was visible everywhere. Extra equipment, not yet restocked, staff moving with the drained efficiency of people who had given a lot of themselves in a short period and were now running on completion. The team was in the family consultation room off the trauma bay. standard procedure for non-patient family and associates, which was a category that seemed to fit them. 3 of them were in there. The 4th, Reyes, was still in Bay 1 with Tate monitoring him. The team leader was standing when she came in. He had the automatic quality of someone who stands when someone enters a room, not performed courtesy, just reflex, and the kind of reflex that gets built into a person by sustained habit. He looked at her differently now than he had in the trauma bay. In the trauma bay, he'd been assessing her in real time, rapid and functional. Now there was something slower in it, more deliberate. "They said your name was Voss," he said. "Serena Voss?" "Garrett Mullen." He didn't offer a hand, neither did she. "These are Decker and Faraday." The other 2, one compact and dark-haired, one taller with a face that looked like it had been broken at least once, nodded in the way that people nod when introductions are a formality, and they're waiting to see what comes after. "Reyes is stable," she said. "The hemothorax is draining. He's going to need to stay monitored for the next 24 to 48 hours. The physician can give you the specific parameters. There's no indication yet of additional internal damage, but he'll need imaging once he's stabilized enough to tolerate moving him." Mullen was watching her carefully. "You're not his doctor." "No, I'm the nurse who was in the room. I'm telling you what I saw." Which was left lateral chest, 7th intercostal space. Field dressing was appropriate, slowed the bleeding, but couldn't stop it. He had a hemothorax developing, blood compressing the lung. The chest tube drained it. He's breathing better than when he came in. She paused. Whoever packed that wound did a good job. It bought him the time he needed. Mullen looked at her for a moment without speaking. Decker and Faraday were still, watching. "Faraday packed it," Mullen said finally. She looked at Faraday. "Good work." Faraday's face did something brief and complicated. Acknowledgement, maybe, or something closer to relief. The specific relief of someone who has spent the last 40 minutes not knowing if what they did was enough. "What do you need from this facility?" she asked Mullen. "Logistically. Quiet. Time. Communication on his status every 2 hours. I'll make sure the physician knows that's the request." "Not the physician," Mullen said. "You." She stopped. "I'm not currently. My status here is complicated right now." "Is that why there was a woman at the front who looked like she'd swallowed something unpleasant when I asked for you?" Serena didn't answer that. "I don't care about your hospital's internal politics," Mullen said. Not harshly, flatly, the way someone states a fact. "Reyes is my man. I want someone communicating with me about his care who knows what they're talking about. You're the only one I've met in this building who qualifies." He paused. "So I'm asking again. What's your situation?" She looked at him, held it for a moment. "I was placed on administrative suspension this morning," she said, "before your aircraft landed. There's a review in progress." Mullen's expression didn't change by much, a small shift at the eyes. "For what?" "Scope of practice violations." She watched him process that. "I intervene when patients need intervention. Some people find that inconvenient." Decker spoke for the first time. His voice was quiet and dry. "In my experience, inconvenient and wrong aren't the same thing." She looked at him. "No, they're not." Mullen was quiet for a moment. When he spoke again, his voice had a different weight to it, careful in a way it hadn't been before. "Where did you practice before here?" "Various places." "Civilian?" She looked at him steadily and didn't answer. Something moved across Mullen's face. Not surprise exactly, something more like a hypothesis becoming more likely. "How long have you been in Harrow Falls?" 8 months. "Before that?" "Different places," she said again. Mullen studied her face for a long, quiet moment. His operators didn't move. The room had the particular dense quality of a space where something is being understood but not yet spoken aloud. "All right," he said finally. "Voss, can you get us access to Reyes?" "Yes," she said. "Give me 5 minutes." She walked out of the consultation room and into the hall, and she could feel Mullen watching her until she turned the corner, and she did not know exactly what he was thinking, but she had a reasonable sense of the direction, and she was not ready for that direction yet. She wasn't sure the hospital was ready for it either. She went to find Tate, because Tate was the easiest person in this building to work with right now, which was not something she'd expected to be thinking when the shift started. Tate was at the nursing station outside Bay 1, charting, with the slightly dissociated expression of a second-year resident who had been awake for too long and had seen too much in the last 3 hours. He was 28 maybe, with a genuinely good clinical instinct that was still buried under the reflexive deference of someone who hadn't yet learned which parts of training to trust and which parts to question. "How's Reyes?" she asked. Tate looked up. "Better. Vitals coming up. I want to get a chest film now that he's stable, confirm the drain position and check for anything we missed." "Good call. The team wants 2-hour status updates." "That's..." Tate hesitated. "I should run that by Dr. Holloway." "You should," she agreed. "I'm just telling you what the request is." He hesitated again. He did that, a slight delay before action, the processing pause. I heard you were suspended." "I am." "Then should you be..." "The team leader asked for me specifically," she said. "Harris cleared it. I'm coordinating their communication, not practicing medicine. You're the clinician." She looked at him. "I'll back you up on the charting." He blinked. "You'd do that?" "You're doing a good job. I've been watching you tonight." She said it plainly, not as flattery, but as information, and she could see him receive it as such. A small straightening, a settling. "Trust your reads. You caught more than you think you did tonight." He nodded slowly. "Okay, I'll talk to Holloway about the updates." "Good." She went back down the hall toward the trauma bay and almost walked directly into Holloway, who was coming from the opposite direction with the particular forward-leaning stride of a man with something in mind. He stopped when he saw her. For a moment they just looked at each other. The physician who had filed complaints and frozen at critical moments, and then, under pressure, performed adequately when given clear direction, and the nurse he'd spent months trying to diminish, and the space between them had a weight to it that neither of them moved to address. "The team leader wants updates," Holloway said finally. "He asked for you." "I know. I'm the attending physician." "I know that too." His jaw tightened. "I don't appreciate being sidestepped in my own department." "Then I suggest telling the team leader that directly," she said. "He seems like someone who responds well to clear communication." Holloway stared at her. She could see him building towards something. A reprimand, maybe, or a threat. The next escalation in a series of escalations that had been building for months. She waited for it, standing still, not defensive, not conciliatory, just present and unmoved. But whatever he was building toward never finished constructing itself. Something stopped it. Maybe the morning he'd just had, the mass casualty event, the tamponade he'd missed, the chest tube that had gone in while she anchored the patient. Maybe all of that was still sitting in him, unprocessed, and whatever he'd been about to say landed somewhere against the reality of those 2 hours and couldn't quite maintain its shape. "We'll discuss your status after the review," he said finally. His voice was flat. "Happy to," she said. He walked past her. She exhaled slowly once he was out of sight. Not with relief, she wasn't relieved, she was too tired for relief, but with the particular release of energy that a held position requires, the physical cost of standing still under pressure and not moving. The trauma bay was quieter now. Yolanda was restocking equipment in the corner. When Serena came in, Yolanda looked at her for a moment, assessing, the way she always did, and then went back to restocking without speaking, which was its own kind of comment. "You should go home," Yolanda said, not looking up. "You've been here 16 hours. The team has Tate and Holloway. You're suspended, Serena. You've done what you can do." Yolanda put a supply bag down and turned around. "Go home. Sleep. Come back and fight when you have the energy to fight it properly." "I'm not fighting." "You've been fighting since you walked in here 8 months ago. You're just quiet about it." Yolanda crossed her arms. "Which is why you're winning, by the way. Not that anyone will say so." Serena looked at her. "Is there something you want to tell me?" Yolanda's expression shifted, something careful in it, deliberate. "The team leader, Mullen. While you were in the hall just now, he went back to the desk. He was making a phone call." She paused. "I wasn't listening on purpose, but I heard him say a name." "What name?" "Yours," Yolanda said, "and after your name, he said 2 more words. She looked at Serena steadily. He said, "Confirm service." The supply room felt suddenly very small. The fluorescent lights hummed overhead with a frequency Serena had never noticed before. "Then he hung up," Yolanda said, "and he went back to sit with his man." She tilted her head, watching Serena's face with the careful attention she'd been bringing to it for months. "You want to tell me what that means?" Serena stood very still. From the ambulance bay, somewhere distant, she heard the radio crackle, county dispatch, some other emergency, the continuous mechanical pulse of a system that did not pause. Through the window at the end of the hall, the Montana morning had deepened to a pale clear blue, cold and high and clean. "It means," Serena said quietly, "that I should probably make some calls of my own." She didn't say anything else. She walked to the supply room door and stopped there with her hand on the frame, her back to Yolanda, and for one moment she was absolutely still. Not calm exactly, but contained, a stillness that had a great deal moving underneath it. Then her phone rang. She looked at the screen. The number was not in her contacts, but the area code was one she recognized from a different part of her life, from a time before Harrow Falls and before Montana, from a time she had chosen, deliberately and with full awareness of what she was giving up, to leave behind. She answered it. "Voss," she said. The voice on the other end said 3 words. Her eyes closed for 1 second. 1. And then they opened. "Understood," she said. "When?" The voice said something else. "Understood," she said again. She ended the call. She put the phone in her pocket. She turned around and Yolanda was still standing exactly where she'd been, watching her, and Serena looked at her for a moment with an expression that Yolanda would describe later, to herself, as the face of someone who has just watched a door open that they thought was permanently shut. "Go home," Yolanda said again, but softer now. "Not yet," Serena said. She walked back toward the trauma bay because Garrett Mullen was going to walk out of Reyes's room in the next few minutes, and she needed to be there when he did, and she needed to be ready for the conversation that was coming, the one that was no longer about her suspension or Holloway's complaints or Curtis Harris's folder, but about something much older and much larger and much harder to contain once it started moving. Down the hall, the door to Bay 1 opened. Mullen stepped out. He saw her standing at the end of the corridor, and the look on his face told her that the phone call had already happened on his end too, that whoever he'd called had already confirmed whatever he'd asked them to confirm, and that Garrett Mullen, who was clearly a man who encountered surprising information regularly and processed it without visible disruption, was nonetheless looking at her right now with an expression that contained something she had not expected to see from someone like him. It looked almost like awe. She walked toward him, and he didn't move, and the distance between them closed in the particular silence of 2 people who have both just received the same information from different directions and are now deciding how to stand inside it. "Your name isn't just Voss," Mullen said. It wasn't a question. "It's always been Voss." "You know what I mean." She stopped 3 feet from him. "What did they tell you?" "Enough." He looked at her with that same careful precision, but the calculation had changed in it. The hypothesis was now confirmed, and he was reorganizing around a new set of facts. Staff Sergeant Serena Voss, 75th Medical Battalion, attached to a Special Operations Support element for 3 rotations, separated 14 months ago. He paused. "They didn't tell me why you separated." "They wouldn't know why," she said. "It wasn't their business." "Is it mine?" She considered that. "No." He accepted that without pushing, which told her something about him. He knew which questions mattered and which ones were just curiosity wearing the clothes of relevance. "You came here, to a regional hospital in a town with 4,000 people and a chemical plant. The job was available. There were other jobs. This one came with a contract in housing assistance," she said flatly. It wasn't symbolic. Something moved briefly across his face, not quite a smile, but adjacent to one. "Fair enough." He looked down the hall toward Bay 1. "Reyes is asking for you." That surprised her. She didn't show it. "Why?" "Because when he came to in the bay, and you were holding his shoulder and talking him through the procedure, he registered it. He said you talked like you'd been in the field." Mullen looked back at her. "He's not wrong, is he?" She didn't answer. He's also asking because he's scared, Mullen said. Quieter now, with the specific plainness of a man who uses that word rarely enough that it lands with real weight when he does. Reyes doesn't scare easy, but he's got a tube in his chest and he's in a small hospital in a state he's never been in, and his team can't stay past the next 6 hours because we have an obligation we cannot defer, and he's going to be here alone. He looked at her steadily. He wants to know if someone competent is going to be watching him. The weight of that sat between them. I'm currently suspended, she said. I'm aware. Does that change your answer? She held his gaze. There was a version of this where she was smart about it, where she protected herself, let the process run, waited for the review, and let Harris's reconsideration happen on its own timeline. That was the careful version, the version that didn't give Holloway and Page any additional ammunition. And there was the other version, which was the one she was already living. No, she said. It doesn't. She went into Bay 1. Reyes was propped up at 30 degrees, correct positioning for a chest tube, with the monitor running steadily and the drainage collection visible below the bed. His color was better, not good, but better. The gray-yellow had retreated and something closer to normal skin tone was coming back, still pale but living pale rather than the evacuated quality he'd had coming off the helicopter. He was watching the door when she came in. His eyes had the particular alertness of someone who is in significant pain and refusing to demonstrate it, which was a posture she recognized immediately because she'd seen it in 3 countries and 2 different uniforms, and it always looked the same regardless of everything else. Voss, he said. His voice was rough. Reyes, Mouse. She came to the side of the bed and checked the drainage collection without being asked, volume, color, rate, and then checked the tube position by palpation, gentle, watching his face for any indication of displacement discomfort. Tell me the truth about this thing, he said. About the tube? About all of it. What's in my chest, what the timeline is, what I'm dealing with. She looked at him directly. He was watching her with the focused expectation of someone who knows when they're being managed and will not tolerate it. You had blood accumulating in your pleural space. The tube is draining it. You've put out about 300 cubic centimeters since insertion, which is significant but manageable. It means you were bleeding into the cavity, but the source was not arterial, otherwise you'd have lost a lot more faster. Translation. Something small was bleeding, not your main vessels. The tube is doing its job. If the drainage slows and your vitals hold, you're looking at 48 hours here and then transfer to a facility with thoracic surgical capability for evaluation and tube removal. And if it doesn't slow, then you need a surgeon. The nearest one who can do this work is in Billings. He was quiet for a moment, processing. What's the actual probability? That you need surgery? She thought about it genuinely, not the managed answer, the real one. 50-30, 60% you drain and stabilize, and this is just time and monitoring. 30% you need intervention, 10% something we haven't seen yet. She held his gaze. I won't know more until the imaging. He nodded slowly. It cost him something. The movement pulled at the tube insertion site, and she could see the tightening around his eyes, even though his jaw didn't move. Okay, he said. Okay? That's what I needed. He looked at the ceiling for a moment. My team's leaving in 6 hours. Mullen told me. You'll be here? She paused. Yes. He looked back at her. Mullen said your situation is complicated. Hospital politics. Reyes made a sound low in his throat, not quite derisive, but in the neighborhood. Somebody gave you trouble for doing your job. Something like that. That happened to you a lot? She looked at him, and for a moment she let something honest sit in her expression rather than managing it away. Often enough that I've gotten good at the paperwork afterward. He looked at her for a long moment. You were in the field. I was in the field, she said. Which unit? She met his eyes steadily. Medical support. He processed that with the efficiency of someone who knows how much context lives in a 2-word answer. How many years? 7. Then you walked into a small-town hospital and let someone make your life difficult for 8 months. He said it without judgment, just clear, the way he'd received everything else. Why? She pulled his blanket up 2 inches where it had shifted. Because the hospital needed someone who knew what they were doing. That's not the real answer. It's the answer I'm giving. He looked at her for another moment and then, with the exhaustion of someone who has used up their reserve energy on the conversation and on the pain, he let his eyes close. Then stay in the building, he said, while my people are gone. Just stay in the building. I will, she said. She left him to sleep. In the hallway, the morning had fully arrived and with it the day shift, which meant a different population of faces and the particular institutional shift in energy that comes when fresh staff walk into a space that the night shift has been holding under pressure. Day shift charge was a man named Brooks, who had worked at Harrow Falls Regional for 6 years and who knew about Serena's suspension because Paige had sent him a text at 5:30 in the morning, which Serena learned because Yolanda intercepted him at the nurse's station and said something quiet and pointed, and he'd gone to find Harris instead of Serena. Harris was in the hallway when she turned the corner, and their near collision stopped both of them. He looked at her, looked at the door to Bay 1 behind her. His expression had a new quality in it. The recalibration she'd seen starting in the locker room was further along now, the internal accounting more advanced, and there was something else in it too. Discomfort. Not guilt, not yet, but its precursor. Military Affairs Office called the hospital, Harris said. 15 minutes ago. She waited. They confirmed a Sergeant Voss's service record, medical role, special operations attachment. He looked at her. Why didn't you tell us? You didn't ask about my background, she said. You asked about my compliance with hospital policy. Serena. Mr. Harris. She kept her voice level. You asked me to surrender my badge based on documentation that characterized my clinical interventions as reckless scope violations. None of that documentation mentioned patient outcomes. None of it mentioned the specifics of what I actually did or why. It just said I overstepped. She paused. Would my military record have changed how that documentation was written? He didn't answer, which was its own answer. I didn't think so, she said, so I didn't offer it. He looked at her for a long moment, and she could see the administrator in him wrestling with something. Not the truth, he knew the truth, but the institutional implications of the truth, the way acknowledging what had happened set other things in motion that were harder to manage. The review is still necessary, he said. There are procedures. I know there are procedures. I want the review. In writing. All of it. She looked at him steadily. What I also want is to be in this building for the next 48 hours while that patient in Bay 1 is under our care because his team is leaving and he asked me specifically to stay and I told him I would. Harris looked at the floor, looked up. You understand this is irregular. My whole morning has been irregular. A silence. Then, you can stay in the building. I'll note it as voluntary consulting pending review. Is. He said it carefully, the way a man speaks when he's choosing language for a document he knows will matter later. You won't practice in any formal capacity. I'll observe, she said. Yes. She nodded once. He walked away and she watched him go, and she thought that he was a man who was running out of the particular confidence that comes from believing your institution's processes are clean, and that this was not a comfortable experience for him, and that he had not yet fully arrived at the question of who in his building had made them dirty. That question was coming. Oh, she didn't expect it to come as fast as it did. Yolanda found her at 11:15 in the supply corridor, and her face had the tight, controlled expression of someone carrying information that has sharp edges. Holloway's in with Harris, Yolanda said. That's not unusual. He's been in there 40 minutes. Paige went in 20 minutes ago. Yolanda paused. I heard Holloway's voice through the wall. He was talking about the military personnel. He said, she stopped, chose her words. He said that allowing a suspended nurse unsupervised access to military patients was a liability exposure for the hospital. Serena was still. He's not wrong that it's a liability question. He was also talking about the Belcourt event, the tamponade case. Yolanda looked at her directly. He's saying he caught it, that you were in the room observationally, and he made the call. The supply corridor was very quiet. He's changing the record, Serena said, not with anger, with the flat clarity of someone confirming a diagnosis they'd suspected for a while. He's trying to. Yolanda's voice had something hard in it. Tate was there. Tate is a second-year resident who reports to Holloway. Tate is also a person who knows what happened, Yolanda said. And I was in that bay, Serena. I saw you hand him the probe. I saw his hands after you set it up. I have charting timestamps that don't match the narrative Holloway is building. Serena looked at her. You documented it? I document everything, Yolanda said, with a precision that suddenly made the 3 years of careful observation make a different kind of sense. I have for 2 months, since the Harris case. The supply corridor felt very small and very significant at the same time. Serena stood in it and understood that Yolanda Briggs, who had told her she watched to figure out whether she was the most competent person in the department or the most dangerous one, had apparently reached her conclusion long ago and had been quietly building something ever since. Why? Serena asked. Yolanda looked at her. Because someone needs to. She held Yolanda's gaze for a long moment. Then, from the far end of the hall, Harris's office door opened, and Holloway came out. He walked down the corridor toward them, and when he saw Serena standing near the supply room, his stride hesitated for one step, just one, barely perceptible, and then steadied, and he kept walking. He was going to pass her without speaking. She let him get close. Dr. Holloway, she said. He stopped. He looked at her with an expression she hadn't seen on him before. Not the arrogance, not the authority, but something underneath those things, something raw. He was a man who had spent a long career being the smartest and the most certain person in most rooms he occupied, and this morning had not been kind to that self-concept, and he was rebuilding it in real time using the materials available to him, which apparently included revising history. Your status is under review, he said. I know. You should limit your presence in clinical areas. Harris cleared me to observe, she said. In writing. She watched his face. I'd be careful about the Belcourt documentation. Timestamps are precise things. He stared at her. Ultrasound probes have usage logs, she said. Timestamps from the machine. She held his gaze. I'd check those before finalizing anything. Something crossed his face, fast, involuntary, the specific micro-expression of a person who has just been told that the thing they believed was invisible is not. His jaw tightened. He walked past her without responding. She turned to Yolanda. Get me the charting from the tamponade case. All of it. Timestamps included. Already printed, Yolanda said. And that was the moment. Standing in a supply corridor in a small Montana hospital at 11:20 in the morning, holding nothing but documentation and the particular calm of someone who has been through enough that they've learned to see the shape of things clearly. That Serena Voss understood the situation had changed. Holloway had made a move that required evidence. Evidence required investigation. Investigation required people asking questions of everyone who had been in that bay. And one of those people was Tate, who was a second-year resident with a conscience that was still operational. And one was Yolanda, who had been quietly building a record for 2 months. And one of those people, the team leader who had made a phone call and confirmed her service and looked at her in the hallway with something close to awe, was still in this building. She was walking toward Reyes's room when her phone buzzed. A text. From a number she didn't recognize, different from the one that had called her earlier. She stopped in the middle of the hallway. The text had 4 words and a document attachment. The 4 words were, check your personnel file. She opened the attachment. It took her a moment to understand what she was looking at. It was a personnel file, her personnel file, from Harrow Falls Regional, and it had been accessed and modified, the metadata visible in the document properties, and the modification date was 11 days ago, and the editor ID and the metadata belonged to a staff user account. She scrolled through it. Her previous employment history had been altered. The line that should have read previous various medical facilities, references available on request, had been changed to read previous employment unverified. Multiple facility departures noted. References declined to comment. It was not her original file. Someone had rewritten her history inside the hospital's own system, 11 days before Harris's meeting this morning, before the write-ups had technically warranted termination on their own, laying the groundwork, building the picture, making sure that when the review happened, there would be a documented pattern of unreliability that went back before her time at Harrow Falls. Someone had planned this, not Holloway alone. Holloway was arrogant and reactive. This was deliberate and premeditated and required system access that a physician didn't typically have. She looked at the sender number again. Anonymous. Routed through something that stripped the origin. Someone inside this building had sent her this. Someone who also had access to the personnel system and had seen the modification and had not been the one who made it. Her mind was moving very fast and very quietly when the door to Bay 1 opened and Mullen stepped into the hallway. He looked at her face. "What happened?" he said. She held up her phone. He took it, read the document, read it again. His expression didn't change much. He was good at that. But she saw the small adjustment around his eyes. 11 days ago, he said, before the formal write-ups reached Harris, before there was official grounds for termination. She took the phone back. Someone built the case before the case existed. Mullen was quiet for a moment. "You have any idea who has that system access?" She did. She had a very specific idea, and if she was right, it meant the thing Holloway was doing with the Belcourt documentation right now in Harris's office wasn't improvisation. It was the second phase of something that had started 3 weeks ago. "Yes," she said. Mullen looked at her steadily. "Are you going to tell me?" She looked at him, then past him at the door to Bay 1, and past that at the hallway and the nurses' station, and the ordinary ongoing machinery of the hospital moving around them as though nothing had fractured this morning. "Not yet," she said. "I need to be sure." She walked past him toward the nurses' station, and behind her she heard him say quietly but clearly, "Voss?" She stopped. "When you're sure," he said, "don't wait." She kept walking. At the nurses' station, Brooks was on the phone, and Yolanda was charting, and 2-day shift nurses were handing off from the night team. Everything looked normal. Everything looked like a Tuesday morning in a regional hospital in a mountain town. She sat down at the far end of the station and pulled up the hospital intranet on a workstation, logging in with her credentials. Suspended staff still had read-only access. Harris hadn't revoked her login yet, possibly because he hadn't thought of it, and she wasn't going to mention it. She went to the personnel system audit log. Every access, every modification, logged automatically. She knew this because she'd read the system documentation in her second week, the way she read all documentation in new environments, quietly and thoroughly and without telling anyone. She typed in the date range. 11 days ago to today. The log loaded. She found the modification to her file. The user account attached to it was a staff account with admin-level access, an access level that in this hospital was restricted to 3 people: the IT administrator, the HR director, and the hospital administrator. Not Holloway, not Page. She stared at the screen. The account ID resolved to a name when she cross-referenced the staff directory. She stared at the name for a long time, and then she thought about the meeting this morning, Harris's office, the folder already prepared, the specific language he'd used, the way he'd known exactly which policy citations to reference without consulting anything, as though they'd been prepared. And something she'd read as bureaucratic thoroughness resolved into a different shape entirely. Curtis Harris hadn't been running the process this morning. He'd built it. She did not move from the workstation immediately. She sat very still, and she thought about it with the methodical discipline of someone who has learned that the space between discovery and action is where mistakes are made. The mistakes that let the people you've caught slip out of the trap because you moved before the trap was ready. Her hands were flat on the desk. The screen glowed. The log entry sat there with its timestamp and its account ID and its irrefutable metadata, the kind of record that could not be argued with by anyone who understood how audit systems worked. She understood how audit systems worked. She took a screenshot with her phone, then another. Then she photographed the cross-reference page with the account ID resolved to Harris's name. 3 copies, sent to her personal email. Then she closed out of the system and sat back and thought about what she knew and what she still needed. What she knew: Harris had personally accessed and modified her personnel file 11 days ago. The modification had been designed to establish a pre-existing pattern of unreliability, a backdated narrative that would make any review panel see her not as a competent nurse targeted by a difficult physician, but as a chronic problem employee that multiple previous employers had struggled with. It was professional character assassination, executed quietly and in advance, with the kind of patience that indicated either Harris had done this before or someone had walked him through how to do it. What she still needed, why? Because Harris was not a man who took personal risks without a reason, and falsifying a personnel record was a risk. Small in a hospital where nobody was looking at audit logs, but real and documented and permanent, the kind of thing that ended careers and invited legal exposure. Men like Curtis Harris did not do that out of abstract dislike for a nurse who had been at his facility for 8 months. She thought about Holloway. She thought about the complaint structure, the timing, the specific language in each write-up. She thought about the Belcourt event and what had emerged in the aftermath. The tamponade, the chest tube, the performance gaps in the attending physician's response, the things that would have been visible to anyone watching carefully. She thought about Dalton, the plant worker, and his severed arm. And she thought about the question she hadn't asked yet because she'd been too focused on her own situation to ask it. What exactly had happened in that bay before she'd come through the curtain, and how different were the medical records from what she'd observed? She pulled up Dalton's chart. The record of the tamponade intervention listed the attending physician as the primary provider. Her name was not on it. The timeline in the chart had the ultrasound assessment documented as Holloway's own clinical decision, the pericardiocentesis noted without any reference to who had identified the indication. She read it twice. Then she looked at the timestamp on the chart entry. It had been filed at 8:47 this morning. The intervention had occurred at approximately 5:10, almost 4 hours after the fact. Holloway had gone back and filed the record of a critical intervention 4 hours later, and had filled it differently from how it had happened, and he'd done it knowing she was suspended and that her access to challenge it would be limited. She sat with that for a moment. The problem was that a physician filing their own clinical notes after a busy trauma night was not inherently suspicious. Charts often got completed hours after events during mass casualty situations. What was suspicious was the specific content of the late entry and the contrast with the documented timestamps from the ultrasound machine, which logged its own usage automatically and which nobody had thought to alter. She needed Tate. She found him in the resident workroom off the main hall, a small room with 2 chairs and a table covered in journals, and an old whiteboard with something about fluid resuscitation ratios half erased. He was eating something from a vending machine bag without apparent enjoyment, the way people eat when they haven't registered hunger but their body has overruled them. She closed the door behind her. He looked at her. "You're still here." Military patient. Harris cleared it. She sat in the opposite chair. "I need to ask you something about the Belcourt event." He put down the bag. "Okay." "The tamponade case. Bay 1, approximately 5 a.m. Walk me through what you remember." Tate looked at the whiteboard. Patient came in hypotensive. Presenting etiology seemed to be hemorrhagic from the amputation, but wasn't responding to resuscitation as expected. "You came in?" "I remember that. You weren't supposed to be." "And you had the ultrasound probe already." You pressed it to his chest. He paused. "I saw the image. I knew what it was. I'd seen it in sim, but not live." "Then what?" Dr. Holloway looked at the screen. "You handed him the needle tray. He did the procedure." Tate looked at her carefully. "You guided him. You kept your hand on the probe while he accessed. He followed the image. Have you seen the chart entry for that case?" He hesitated. "This morning, Holloway asked me to review it for his notes." "And?" Tate was quiet for a moment. The vending machine bag sat on the table between them. "It doesn't describe it the way I remember it." "How does it describe it?" "It describes him identifying the indication on clinical assessment and performing the procedure with resident assistance." He looked at her. "It doesn't mention you." She nodded once. "Is that a problem?" Tate said, and she could hear in his voice the specific tension of a second-year resident asking a question they already know the answer to and are hoping to be wrong about. "Only if accurate documentation matters," she said. He looked at the whiteboard again. His jaw moved. She could see him working through the version of this where he went along with it, where it wasn't his fight, where he was a resident who needed the attending's goodwill, where the incident was already over and the patient was stable, and what did it matter who got credit? and she could also see him finding the edges of that version and what it cost to live inside it. I charted my own observations at 5:16, he said finally, in my resident note. I documented what I saw. He looked at her. Including that you were in the room. I know, she said. I saw the timestamp. She stood up. Don't change it. I wasn't planning to. She looked at him for a moment. He was young, and he was tired, and he was in the beginning of understanding that the institution he'd committed years of his life to entering was not the one he'd imagined, and there was nothing she could do about that except this. You did well last night, the Belcourt event. Your clinical instincts were right more often than not. He blinked. I froze on the tamponade. Yes. And you won't freeze on the next one. She opened the door. That's how it works. She left him with his vending machine bag and walked back into the main hallway and made herself think clearly about what she had and what it meant and what came next. Mullen found her before she found him. He came around the corner from the direction of the family consultation room with Decker behind him, and the specific directional energy of someone who has been waiting and has run out of patience for it. The 6-hour mark is in 40 minutes, he said. I know. I need to know Reyes is covered before we leave. He's covered. She looked at Mullen. Tate is his physician of record, and Tate is competent. The chart has accurate documentation. I'll be in the building. That's not... He stopped, started again. The situation with your hospital. You told me it was politics. That's not what it is. She looked at him. I've been making some calls, he said, while I've been sitting in that room. The kind of calls I'm able to make that most people aren't. His voice was level and without apology. Your personnel file has a modification flag on it, 14 days ago. 11, she corrected. His eyes sharpened. You already knew. I found out an hour ago. Who? She looked at him for a long moment. Around them the hospital moved, a gurney going past, a phone ringing at the nurses' station, the ordinary operational sounds of a place that was doing its job despite everything happening inside its walls. The administrator, she said. Mullen said nothing for a moment. Decker, behind him, went very still. Harris, Mullen said. Yes. Why? That's what I'm still working on. He looked at her with that careful precision, the storing and organizing of information. You need documentation beyond the audit log. I need to know who else is involved and what the motive is, because right now I have evidence of falsification, but not of intent, and intent is what makes it actionable rather than just a policy violation. A personnel file falsification is more than a policy violation. In a hospital with a board that wants this quiet, it becomes whatever narrative the board decides is least disruptive. She met his gaze. I've seen it before. Clean documentation isn't enough if the institution controls the review process. Mullen looked at her for a long, quiet moment. Then he said, What do you need? An independent investigation. Someone outside this hospital's chain. That I can arrange, he said. Reyes's situation gives me a legitimate basis for requesting an external review of the facility's treatment protocols and personnel conduct as it relates to the care of military personnel. He said it flatly, like reading a regulation. It's not subtle, but it gets someone outside this building asking questions. How fast? I can have a request filed in 2 hours. Formal inquiry initiated in 24. She thought about that. About what 24 hours looked like inside a hospital where Harris knew the audit log had been accessed. And he would know because audit logs were monitored by IT, and IT reported to Harris. And the moment someone noticed her login on the personnel system this morning, there would be a conversation that reached him. He'll move to finalize my termination before the inquiry gets here, she said. Probably. Which means I need something that stops that. Mullen looked at her. What would stop it? Evidence of motive, she said. If I can show this wasn't just professional friction, if I can show why he specifically needed me discredited and removed, then the falsification becomes part of a larger picture that the board can't dismiss as internal conflict. And you have a theory about the motive. I have a direction, she said. I need an hour. He checked his watch. I have 40 minutes before we leave. After that, you're on your own until the inquiry arrives. That's enough time to either find it or not find it, she said. She went back to the nurses' station. This time she wasn't going to the personnel system. She went to the financial management portal, a part of the hospital intranet that nursing staff had read only access to for billing reconciliation purposes. A low-security door because nobody expected a nurse to know what they were looking at in a hospital financial system. She knew what she was looking at. She had spent 14 months in a support role that required understanding operational budgets, procurement chains, and the ways that resources moved in and out of complex organizations. It was not the primary skill set she'd brought back from her service, but it was one she'd acquired sideways and kept. She went to the procurement records for the last 12 months. She was looking for Belcourt, not the explosion. That was too recent. She was looking for the relationship between Harrow Falls Regional Medical Center and the Belcourt Chemical Processing Facility in the months and years before the explosion. The contract relationship. Because hospitals in small towns often had agreements with major local employers, occupational health services, pre-employment physicals, incident response protocols. She found it in 11 minutes. Harrow Falls Regional held a contracted occupational health and emergency response agreement with Belcourt Chemical, renewed annually. Standard in a town this size with an employer this large. Nothing unusual. What was unusual was the addendum filed 8 months ago, the same month she had arrived. The addendum modified the incident reporting protocol. Previously, any workplace injury or illness assessed at Harrow Falls Regional that was potentially attributable to Belcourt facility conditions was to be reported to the Montana Department of Labor and Industry within 72 hours. The addendum changed the reporting timeline to 30 days, and it added a clause specifying that reports would be reviewed by the facility administrator prior to submission. Harris. She sat with that. Thought it through. The previous reporting protocol meant that a nurse who identified a pattern, repeated chemical exposures, musculoskeletal injuries consistent with unsafe equipment, respiratory presentations clustered around specific shifts, and documented it thoroughly in patient charts, could generate reports that reached state regulators relatively quickly. The kind of reports that triggered inspections, the kind of inspections that found problems, the kind of problems that cost a chemical plant its operating license. The new protocol meant all of that went through Curtis Harris first. Harris, who had signed a revenue-sharing agreement with Belcourt in the same addendum, a 5% increase in the facility contract rate in exchange for the modified reporting structure. The kind of financial arrangement that, if examined by the right eyes, looked like exactly what it was. She had seen 3 Belcourt workers in the ER in her 8 months at Harrow Falls. She had documented their presentations thoroughly: chemical exposure indicators, respiratory patterns, injury mechanisms consistent with inadequate safety protocols. She had filed accurate, detailed charts, the kind of charts that, if pulled in an inspection, would tell a clear story about conditions at the plant. The kind of charts written by a nurse who, if she became a liability and unreliable, if her records were dismissed as the work of a chronic problem employee with a history of recklessness and falsification, would not generate the kind of regulatory attention that ended facility contracts and cost administrators their arrangements. She took photographs of everything. She sent them to her personal email. She stood up from the workstation and her legs were steady and her hands were steady, and inside her chest something was moving that she did not have a clean name for. Not triumph, it was too early for triumph, too much could still go wrong, but the clarifying satisfaction of a thing becoming fully visible that you had sensed in outline for a long time. She went to find Mullen. He was in the hallway outside Bay 1, jacket on, ready to move. Decker and Faraday were behind him, the same readiness in all 3 of them, the physicality of people who have learned to exist in the compressed space between presence and departure. She handed him her phone. He read it, scrolled, read the addendum, looked at the revenue figures, looked at the reporting modification. His jaw moved once. He handed the phone back. "This is why you needed to go," he said. "Yes." "Your charts were the paper trail." "Yes." He looked at her steadily. "You knew this was coming." "Not exactly this, but I knew I documented things that made someone uncomfortable." She looked at him. "I thought it was Holloway." Holloway was the instrument. Harris was the reason. Mullen was quiet for 10 seconds. She could see him organizing it, not emotionally, operationally, the way you organize when a situation is clarified and now requires decisions. The inquiry I file will flag medical contract compliance, he said. That gets DOL eyes on it within 48 hours, not just the hospital board. That's what I need. It's going to make your next 72 hours difficult. Harris will move the moment he knows an external inquiry is coming. I know. Do you want to wait for backup or move now? She thought about Reyes in Bay 1 with his chest tube and his steady vitals and his team about to leave. She thought about Tate with his accurate resident note and his intact conscience. She thought about Yolanda and 2 months of careful documentation. She thought about Dalton, the plant worker with the severed arm, who was somewhere in this hospital recovering from surgery, and about how many other Daltons there had been in the last year, whose charts now sat in a system being managed by a man with a financial reason to keep them quiet. Now, she said. Mullen held her gaze for one more moment. Then he nodded once, the small, precise nod of someone who has made a decision and will now execute it, and turned to Decker. File it, my authorization, priority flag. Decker pulled out his phone and walked 2 steps away. Voss, Mullen said. She looked at him. When this is over, he said, however it goes. He looked at her with that same careful precision, but there was something in it now that hadn't been there in the trauma bay. Not the awe she'd seen in the hallway, something quieter and more durable than that. That unit you were attached to. They didn't want to lose you. She looked at the floor for a moment. I know, she said quietly. It was still the right call. Maybe, he said, or maybe the right call was this. Just a longer road to get here. She didn't respond to that. From the nurse's station, 30 feet away, she heard the sound she'd been waiting for and dreading in equal measure. The specific tone of Harris's voice as he came around the corner from the administrative corridor with Paige beside him and a folder in his hand and the forward-leaning stride of a man who has decided to finalize something. He hadn't seen her yet. Paige had. Paige stopped for a half step, and Harris stopped because she stopped, and he followed her gaze to Serena standing near Bay 1 with Mullen behind her, and his face did something that took her a moment to identify because she hadn't seen it on him before. It was calculation failing. He had come out here to do something specific, and the presence of Mullen in military field gear standing 2 feet from the nurse he'd been planning to remove had broken the calculation, and the folder in his hand looked suddenly less certain than it had looked 10 seconds ago. She held his gaze across 30 feet of hospital corridor. He looked at the folder, looked at Mullen, looked at her. Mr. Harris, she said. Her voice was entirely calm and carried exactly far enough. Before you open that folder, I think we need to talk about the Belcourt contract addendum. The hallway went very quiet. Paige's face changed. And Harris, who had been a composed man all morning, who had sat across from her in an office and delivered paperwork and used the language of procedure and policy with the fluency of a person who had been inside institutions all his life. Curtis Harris, who had planned this carefully and executed it patiently and believed he had controlled every variable. Curtis Harris went pale in a way that moved from his face down through his neck and into his shoulders, a physical draining that happened slowly and completely, and it was the most honest thing she had seen him do since she'd met him. The folder was still in his hand. She looked at it. You might want to put that down, she said. He didn't move. And behind him, from the direction of the main entrance, came the sound of the automatic doors sliding open, and into the hallway walked 2 people in suits, not hospital administration suits, not the pressed shirt institutional look she associated with this building. Different. The particular unremarkable professional quality of people whose job is to find things out and who have learned to look like they aren't doing it. One of them held a credentials wallet open as they walked. Montana Department of Labor and Industry, Division of Occupational Health and Safety. Decker's phone call had apparently reached someone faster than 48 hours. Harris turned around. He saw them, and the folder fell from his hand to the floor, the papers spreading in a loose fan across the linoleum, and nobody moved to pick them up. The papers were still on the floor. Nobody had moved to pick them up. The 2 investigators from the Department of Labor and Industry stood just inside the entrance doors with the particular patient stillness of people who have walked into rooms mid-situation before and have learned to read the temperature before they speak. The one with the credentials wallet, a woman in her 40s, short dark hair, the kind of face that missed very little, looked from Harris to the folder on the floor, to Serena, and then to Mullen, and made her own quiet assessments. "Mr. Curtis Harris?" she said. Harris turned around slowly. He was still pale. "Yes." "I'm Investigator Diane Okafor, Montana Department of Labor and Industry. This is my colleague, Agent Restad." She didn't extend her hand. "We've received a priority request for a compliance review of this facility's occupational health reporting practices as they relate to contracted industrial employers. We'll need access to your administrative systems and a private space to conduct initial interviews." Harris's mouth opened, closed. "Today," Okafor said, not unkindly, just clearly. He looked at Paige. Paige looked at the floor. That small movement, the withdrawal of the person who had been his operational partner in this for months, seemed to land on him with physical weight, and she watched him absorb it and recalibrate and find nothing useful on the other side. "Of course," he said. His voice had lost its register. "Of course. My office is on the second floor." Okafor nodded. She looked at Serena once more as she passed, a measuring look, professional and brief, and then followed Harris toward the elevator with Restad behind her. The hallway held its silence for another 5 seconds. Then Yolanda, who had appeared from somewhere near the nurses' station and had apparently witnessed the entirety of it, said, "Well." Mullen looked at Serena. 48 hours was optimistic. "You made the right call," she said. "You made the right call," he said. "I just made a phone call." He checked his watch. "I need to see Reyes before we leave." She walked him to Bay 1. Reyes was awake, propped up the same way she'd left him, but the quality of his alertness was different, less effortful, more present, the difference that adequate oxygenation and a functional lung make in how a person inhabits their own face. The drain was still working, the monitor was steady. He looked at Mullen when they came in, then at Serena, and back to Mullen, reading whatever was in their posture the way he clearly read most things, quickly and without requiring explanation. "How bad is it out there?" he said. "Handled," Mullen said. "For her or for the hospital?" "Both, probably. It's moving." Reyes looked at Serena. "You okay?" She thought about the question. Whether she was okay was a complicated answer that touched on things she wasn't ready to examine in a hospital bay with 2 soldiers watching her face. "I'm standing up," she said. "That's sufficient for right now." Something in his expression acknowledged that answer as the exact right kind. "I'm going to be here a while. 48 hours, probably longer. The drain output is slowing, which is what we want. Tate will be your physician. He's competent." She paused. "I'll check in." "You don't have to." "I told you I would." He held her gaze for a moment. Then, "Thank you, Voss, for the procedure, for staying." He said it with the directness of someone who doesn't add decoration to things that don't need it. "You didn't have to be in that room." "I was in the building," she said. It was the simplest true version of why. He nodded once. It was enough. Mullen touched his shoulder briefly, the specific economy of gesture between people who know each other through the particular intimacy of high-stakes circumstances, and then stepped back. Decker and Faraday were already in the doorway. The leave-taking had the compressed quality of people who have learned to say what matters and move. At the door, Mullen stopped and looked at her one last time. "The inquiry is flagged at my level," he said. "It won't get buried." "I know. If it goes the way it should, and it will, someone is going to offer you something afterward." He said it carefully, as if measuring each word for accuracy before releasing it. "Think hard before you turn it down." She looked at him. "I have a contract here." "Contracts end." He held her gaze. "You spent 8 months in a place like this. You know what you're capable of. Don't let other people's comfort with that question become your answer." He left. She stood in Bay 1 with Reyes's monitors beeping their steady rhythm and the morning light coming through the high window at a low angle that caught the dust in the air and made everything look briefly, temporarily, like something out of a photograph. She stood there for maybe 30 seconds, just standing, which was something she rarely did and which the situation seemed to require. Then she went back to work. because that was also what the situation required, and because it was, when everything else stripped away, what she was here for. Tunt. The next 18 hours were the kind of hours that institutions try to manage quietly and never entirely succeed at, because institutions are made of people and people talk. And by noon, the ER floor knew that DOL investigators were on the second floor, and by 2 in the afternoon, the day shift had heard 3 different versions of why. And by 4 o'clock, the correct version had mostly assembled itself through the accumulated observations of people who had been watching for a long time and had simply been waiting for someone to confirm what they already suspected. Holloway heard it from Tate, who hadn't intended to tell him anything and had answered a direct question badly. Serena learned this from Yolanda, who had been nearby, and filed it away as information about Tate's limitations under pressure. Not a flaw exactly, just a known variable. Holloway came to find her at 4:30. She was in the medication room doing an inventory reconciliation that nobody had asked her to do, and that gave her a legitimate reason to be in the department without practicing clinically. She heard him in the doorway before she turned around. "They're looking at my charts," he said. "I expect they're looking at many charts." The tamponade case. She turned around. He looked different than he had at 5 in the morning, different than he'd looked at any point in their 8 months of overlap. The authority was still there in his posture. It was too deeply built to disappear in one day. But there was something underneath it that had been exposed. He looked like a man who had been walking on what he thought was solid ground and had heard it creak. "What do you want, Dr. Holloway?" He looked at her for a long moment. "I want to know how much of this is me." She considered how to answer that. There were several true answers, and they weren't all the same answer. "The chart documentation that was filed this morning is a problem," she said, finally. "The procedure was undocumented correctly with respect to who identified the indication. I performed the procedure." "You did. That's in Tate's resident note. What's also in Tate's resident note is the sequence of events." She held his gaze. "I'm not trying to take credit for a procedure I didn't perform, but the clinical decision chain matters, and it was documented inaccurately." He was quiet. "If I amend the chart—" "That's your decision to make," she said. "With your malpractice counsel present, I'd suggest. An amended chart in the middle of an active investigation needs legal eyes on it." He stared at her. "You're not making this easy." "I'm not in a position to make anything easy for you," she said plainly. "You filed complaints against me for months. You froze during a mass casualty event at multiple critical moments. You filed an inaccurate chart record this morning." She looked at him steadily. "I'm not angry about any of it, but I'm also not going to help you manage your way out of the consequences." His jaw worked. "The tamponade. You knew before I did." "Yes? How?" She paused. "Experience," she said. "The kind that comes from watching people die when you don't catch things fast enough." Something moved through his face. Not quite recognition, but close. He looked at the medication shelves behind her without seeing them. "I've been a physician for 17 years, he said, and his voice had a different quality in it now, flatter, more stripped. "I've had good outcomes, strong record." "I believe that." "Then why—" He stopped. "Because being good most of the time doesn't mean you caught everything, and because a busy trauma night exposes the gaps." She looked at him. "Yours were visible. That's not a verdict on your career, it's information." He left without responding. She watched him go and felt nothing triumphant about it, which surprised her slightly, and then didn't. She had never wanted him destroyed. She had wanted him to stop being an obstacle and to stop filing false documentation, and she was going to get both of those things through channels that didn't require her to feel good about his discomfort. She went back to the inventory. Harris resigned at 7:15 that evening. She heard about it from Brooks, who heard it from the board chair's assistant, who had been in the building when the board convened an emergency session in the conference room on the 3rd floor. She didn't learn the specific terms until later, but what she knew that night was this. The investigation had found the addendum, found the revenue arrangement, found the modified reporting timeline, and found 3 incident reports over the past year that had been held past the regulatory deadline and then filed with language that minimized the occupational exposure indicators that the treating nurses had originally documented. Her incident reports. Her language, changed. That discovery, that Harris had not just modified her personnel file, but had been altering her clinical documentation on Belcourt-related cases for months, was the thing that moved it from administrative misconduct to something with potential criminal exposure. And Curtis Harris had apparently understood that quickly, and had chosen resignation over the alternative. The Belcourt contract was suspended pending investigation. She learned about Paige later, secondhand through Yolanda, who had provided her documented record of the complaint fabrication to Okafor's team in a meeting that lasted 2 hours. Paige had been cooperative with investigators in the way that people are cooperative when they understand that non-cooperation makes their own position worse, and her cooperation had confirmed several things about the complaint structure that Serena had suspected, but not known for certain. Whether Paige had understood fully what Harris was doing or had simply been a mechanism he'd used, following instructions, filing documentation, covering for Holloway because Holloway was covering for the arrangement, was a question for the investigators. What was clear was that Paige would not be returning to a charge nurse role at Harrow Falls Regional. Yolanda told her all of this in the break room at 9 p.m., while Serena drank coffee from her battered thermos and watched the parking lot through the window, where the investigators' cars were still there, and the light in the second-floor administrative corridor had been on since noon. "How do you feel?" Yolanda asked. "Tired," Serena said. "That's it?" She thought about it. "Relieved. A little." She looked at the parking lot. "Not the way I expected to feel relieved." "What did you expect?" "I don't know. Something louder?" She turned the thermos in her hands. "This just feels like the correct outcome, like a thing that should always have been true finally becoming true. There's not a lot of satisfaction in watching an overdue correction happen." Yolanda looked at her for a moment. "That might be the most you've said about your own feelings since I've known you." "Don't make a thing of it." "I'm making a small thing of it." Yolanda leaned back in her chair. "For what it's worth, what you did, the documentation, the audit log, the Belcourt financials, that wasn't just defending yourself. That's going to help people you never met. Plant workers with respiratory damage that's been underreported. Future patients who would have had their charts altered. The investigation is going to pull years of records." Serena was quiet for a moment. "I know. Do you feel anything about that part?" She looked at the thermos, at the parking lot, at the lights in the administrative corridor. "Yes," she said. "That part feels different." Yolanda nodded. She didn't push it further, which was one of the things Serena had come to understand about her. She knew which doors to hold open and which ones to leave closed, and she applied that knowledge with a precision that was its own form of care. At 11:40 that night, Reyes's drainage output had dropped to a clinically acceptable level. Tate filed the updated chart note, consulted with the on-call cardiothoracic surgeon at the Billings facility by phone, and determined that if the current trend continued overnight, the tube could be pulled in the morning. She checked in on Reyes at midnight. He was asleep, genuine sleep, the deep, unguarded kind that comes when a body has been running on emergency reserves and finally finds enough safety to let go. The monitor was steady. The drain collection sat at the number she wanted. She stood in the doorway for less than a minute, pulled the curtain, and left him to it. The night shift had changed, and the ER was in that particular dead hour calm again, a full cycle from the night before, except that everything was different, and she was different inside it. And the building she stood in had a different architecture now. The same walls, same lights, same institutional floors and equipment carts, an overhead PA system, but the internal structure altered. The people who had built the false ceiling were gone. She sat at the nurse's station and finished charting things that needed to be charted. Not her charts, officially. She was still technically suspended. The formal reinstatement would require the board, which would take at least another day. But the kind of observational notes she could file as a consulting presence, which Harris had authorized in writing, and which remained valid regardless of Harris's subsequent departure. She was meticulous about it. She always was. The board met formally at 9 the following morning. She knew it was happening because the board chair, a woman named Elliston, who had a background in hospital administration at 3 previous facilities and who had been visibly shaken by what the last 24 hours had disclosed about the institution she now oversaw, had asked through the interim administrator if Serena would be available. She said yes. She went up to the third floor in her slightly faded navy scrubs with her battered thermos and sat in a chair outside the conference room and waited. She could hear voices through the door, but not words. After 20 minutes, the door opened and Elliston stood in it. "Please come in," she said. The conference room had 7 people in it, 5 board members, the interim administrator, and Okafor, who was present in an advisory capacity. Holloway was not there. Tate was, sitting near the wall with a folder in front of him that he held with both hands, in the way that people hold things when they're nervous and trying not to show it. She sat in the chair they indicated and looked at the board. Elliston sat at the head of the table. She looked like a woman who had not slept well and had made decisions in the night that she was now prepared to execute. "Nurse Voss," she said, "we've reviewed the documentation from the DOL inquiry, the audit logs, the personnel file modification, the altered incident reports, and the independent medical documentation provided by Dr. Restad's team relating to the events of the past 36 hours. She looked at her steadily. "I want to say, on behalf of this board, that what was done to your professional record in this facility was wrong. It was deliberate. It caused real harm to your standing and your livelihood. The board is prepared to offer a formal and complete apology." Serena looked at her. "The administrative suspension is rescinded effective immediately. Your personnel file will be fully restored to its original content, and the falsified modification will be documented as such, with notation that it was the product of administrative misconduct rather than any action on your part." Elliston paused. "All complaints filed by Dr. Holloway during your tenure have been reviewed. In light of the investigation's findings regarding the context in which those complaints were generated, they will be expunged from your record." She heard it, let it land, felt the weight of it. Not relief, still not quite relief, but the specific sensation of a thing that has been pressing on you being lifted, and noticing in that lifting how long you'd been carrying it. "Thank you," she said. "Dr. Holloway," Elliston continued, "has agreed to a formal review of his clinical documentation practices as a condition of continuing his privileges at this facility. The chart amendment for the tamponade case has been filed with appropriate notation of the sequence of events." She looked at Tate briefly. "Dr. Restad's notes have been formally entered into the record." Tate looked like he was sitting slightly straighter than he had when she'd come in. "We are also prepared," Elliston said, "to offer you a position." Serena waited. "The board has determined that this facility requires immediate development of a formal emergency trauma training program and a rigorous occupational health documentation protocol that meets state standards. Both programs need to be built from the ground up, independently from administrative oversight." She looked at her directly. "We would like to offer you the role of emergency trauma training lead and occupational health compliance coordinator. It would carry a full salary adjustment, independent reporting authority directly to the board, and the resources to build both programs to the standard they require." The room was quiet. "You would essentially be redesigning the clinical infrastructure that failed," Elliston said. "We understand this is an unusual position to offer someone under these circumstances, but the inquiry has made clear that the failures here were not random. They were systematic, and they were sustained in part because there was no independent clinical voice with the authority to push back." She paused. "You were that voice without the authority. We're asking if you want the authority." Serena looked at the table in front of her, at her own hands. She thought about Mullen saying, "Think hard before you turn it down." She thought about the plant workers whose charts had been altered. She thought about Dalton, who was somewhere in this hospital still recovering, who didn't know that the paperwork around his injury had been quietly managed. She thought about all the cases like his that had moved through this facility in the year before she'd arrived, managed by a system designed to protect a financial arrangement rather than the people the arrangement was supposed to serve. She thought about what 7 years of field medicine had taught her, which was not just how to keep people alive in the acute moment, but how to build systems and train people and construct the protocols that meant more people got the right care more often, which was harder and slower and less visible than the dramatic interventions, and also, in the accumulated math of it, more important. She thought about what it had cost her to be in this building for 8 months without authority. She thought about what she could do in it with some. "I have conditions," she said. Elliston didn't blink. "We expected that. The training program has full clinical independence. No administrative approval required for curriculum content or evaluation standards. Agreed. The Occupational Health Documentation Protocol is not subject to review by any individual with a financial relationship to contracted employers. It goes directly to state standards without intermediate filtering. Agreed. Yolanda Briggs is promoted to Senior ER Tech with a salary commensurate to her actual function and the option to enter a funded nursing education track if she chooses. A brief pause. One of the board members made a note. Agreed, Elliston said. And Tate, she glanced at him. He was watching her with an expression she couldn't fully read. Dr. Restad gets an independent clinical mentor, not Holloway, someone from outside this facility's current attending roster. We can arrange that, Elliston said. Serena looked at her for a long moment. At the room. At the institutional machinery of it. The table, the folders, the people trying to right something that had been wrong for a long time, imperfectly and belatedly, in the way that institutions always move toward correction, slowly, motivated in part by legal exposure, but moving. Then yes, she said. I'll take the position. Reyes's chest tube came out at 2 in the afternoon. Tate did the procedure, correctly, without prompting, with the specific efficiency of someone who had looked up the protocol the night before and arrived prepared, which was its own kind of growth. Serena was in the room as an observer. Reyes handled it with the same tight jaw and no complaint, and when it was done, he breathed experimentally, and something in his face eased. Better? She asked. Yeah, he said. Better. She checked the site. Clean. The imaging from that morning had confirmed no surgical intervention necessary. The bleeding had been venous, slow, and the drain had done what it was designed to do. He would need 6 to 8 weeks of limited exertion and a follow-up chest film, neither of which she expected him to fully comply with, but which she told him clearly anyway. Mullen will push you on the rest, she said. Mullen will try, Reyes said. She almost smiled. She let herself almost smile, which for her was approximately the same as smiling. I heard things happened out there, he said. He was looking at her carefully. Things happened. You gonna stay? She thought about the conference room upstairs, the conditions, the agreements, the board's relieved compliance. She thought about the plant workers and the unaltered charts she would now be building systems to protect. Yes, she said. For now. Good, he said simply. She pulled on a fresh pair of gloves from the box on the wall. It was a reflex, but she always put on gloves when she finished a procedure, not to start another one, but as a kind of reset, a physical notation of completion. Thank you, Reyes, she said, for asking for me, the morning your team came in. He looked at her. You're the one who knew what they were doing. A lot of people knew what they were doing. Not all of them walked back through the door. He didn't have an answer for that. Neither did she, exactly. It was just true, and true things didn't always require discussion. She left him to rest and walked out of Bay 1 for what felt like the 100th time in 2 days and turned toward the main floor. Yolanda was at the nurse's station when she came down the hall. She was charting, the same posture as always, but when Serena came close, she looked up with the expression of someone who has already heard the outcome and is deciding how to acknowledge it. Brooks told me, Yolanda said. I thought he might. Senior ER Tech. If you want it. Yolanda looked at her for a moment. The nursing education track. Funded, if you choose it. No obligation, no timeline pressure. She held her gaze. It's yours to decide. Yolanda was quiet for a few seconds. She looked at the nurse's station, at the ER floor, at the monitors and equipment, and the ordinary organized business of people being cared for. She'd been in this building for 3 years doing work that had been compensated below its value and acknowledged below its reality, and she had kept doing it because the work mattered, which was the same reason as Serena, and also a different reason because Yolanda had chosen this from within the civilian system and had stayed within it, and that required a different kind of stubbornness. I'll think about it, Yolanda said. That's all I'm asking. Yolanda looked back at her screen. You did a hard thing, she said without looking up. Not the medical stuff. The staying. 8 months of that. She paused. Most people leave. I had a contract, Serena said. You had more than a contract, Yolanda said. You had whatever it is that makes someone show up every day to a place that's telling them they don't belong. She glanced up briefly. That's not a contract. That's a decision you remake every morning. Serena stood with that for a moment. The fluorescent lights hummed overhead. Somewhere down the hall, a monitor beeped, and a nurse responded, and the work went on the way it always went on. The continuous mechanical pulse of a place that does not pause. Thank you, Serena said, for the documentation, for all of it. Thank me by building something that makes it unnecessary, Yolanda said. Next time. That's the plan. She stayed in the building until 8 that evening. She didn't have to. Her shift, officially, had ended at 7 the previous morning, and she was now operating on the new appointment's first day, which had no defined hours yet because she hadn't set them. She stayed because Reyes's evening check needed to happen, and Tate was in the middle of 2 other admissions, and she knew the baseline, and it made clinical sense. She told herself it was because of that. It was partly because of that. She checked in on Reyes, who was asleep again, the real kind, the sustained recovery kind, and left without waking him and wrote a clean, brief note in his chart and handed off to the night nurse with clear and complete information about his overnight monitoring parameters. The night nurse was new to her, a woman named Patterson who joined the day shift 8 weeks ago and who had watched the events of the past 36 hours from a careful distance. When Serena finished the handoff, Patterson looked at her and said, "Are you the one who came back in during the suspension?" "Yes." Patterson considered her for a moment. Why? Because the patient needed someone who knew what they were doing. Patterson looked at Reyes's closed bay door. That's it? That's usually enough. She put on her jacket in the locker room. The same jacket, the same battered canvas, unchanged from the woman who had put it on in this room at 6:15 in the morning, 38 hours ago, thinking she was walking out of a job she'd been removed from. She looked at herself in the mirror for a moment, not with vanity, just the practical check of someone making sure they're assembled correctly before going out into the world. She looked tired. She was tired. She had been awake for going on 40 hours with brief interruptions and the kind of adrenaline processing that takes a physical toll regardless of how disciplined you are about it. She also looked, she thought, like someone who knew exactly where they were standing. That was new. Not the competence. She'd always had that. Had built it at great cost over years in places that demanded it daily or extracted the price of not having it. But the sense of standing in the right place in the right capacity for the right reasons. That had been missing for a long time, since before Harrow Falls, since a decision in a different state and a different life that had felt necessary and correct, and had also cost her something she hadn't fully accounted for yet. She put her thermos in her bag and walked out of the locker room and down the main hall and out through the ambulance bay doors. The night was cold the way Montana nights in October are cold, clean and enormous and without apology. The mountains were invisible except as darker shapes against a sky with more stars than cities ever let you see. The parking lot was mostly empty. The smoke from Belcourt was entirely gone. She stood outside for a moment, just standing, breathing cold air that tasted like high altitude and pine and the specific cleanness of a place where the nearest industrial operation was now under investigation. She thought about what Mullen had said, about the unit that hadn't wanted to lose her, about the longer road and whether this was where it arrived. She didn't know the answer to that. She wasn't sure there was an answer yet, or that answers of that scale announced themselves clearly instead of just slowly becoming evident through the accumulated choices that led toward them. What she knew was smaller and more immediate. Tomorrow she would start building something. Protocols and training curriculum and documentation systems that didn't have trapdoors built into them for financial convenience. She would sit across from physicians and nurses and techs and talk about the things that go wrong in emergency medicine and why. And she would do it with the specific authority of someone who has been on the side of wronggoing and has refused to let it finish what it started. She would do it imperfectly. She had never once in her life done anything of consequence perfectly, and the work had happened anyway, and the patients had mostly survived anyway, and that was the truth of it. That competence is not flawlessness, it is the commitment to keep moving through the flaws toward what matters, and to stay honest about the difference between the two. She thought about Dalton, the plant worker, who was still in this building and who would receive a visit from an occupational health investigator in the next few days, and who might or might not understand that the documentation fight happening around his case had started, in part, with a nurse who filed careful charts. She thought about every patient like him who'd come through in the past year, whose exposure indicators had been altered before the report was filed, and about the plant workers who would come through in the years ahead, and about what accurate documentation meant in accumulated terms. Not the drama of a single intervention, not the chest tube or the tamponade, or the hand inside the wound, but the long, disciplined work of seeing clearly and writing it down correctly and not allowing anyone to change it. That was also medicine, less cinematic, more important. The automatic doors of the ambulance bay slid open behind her and she heard footsteps and turned. Tate was coming out with his coat half on, clearly finished for the night, and he stopped when he saw her standing there. "I thought you'd gone," he said. "Leaving now." He came to stand nearby, looking out at the parking lot, and they stood in the cold in silence for a moment. He was carrying something. She could hear it in the quality of his silence, a weight in it. "I should have documented the tamponade sequence more clearly from the beginning," he said. Not as an apology. As a statement of fact which was more honest than an apology. "You documented what you saw when you saw it," she said. "That's what matters." "I could have said more to Holloway, earlier." "Yes," she said simply. "You could have." He was quiet for a moment. "That's not as reassuring as I was hoping for." "I know." She looked at the stars. "You'll do better next time because you know what it costs not to." He looked at her. "Is that how it works?" "That's how it works," she said. "Nobody learns the important things from success." He zipped his coat the rest of the way. "Congratulations on the position." Or, I don't know if congratulations is the right word. "It's a complicated word for it," she agreed. "Are you glad?" She considered that honestly, the way the question deserved. "I'm glad I can do something useful with it. The rest I'll figure out while I'm doing it." He nodded. He started toward the parking lot and then stopped. "Voss." She looked at him. "The things you said in the resident room about my instincts." He paused, and she could see him finding the right words for something that mattered to him. "I've been in this program 2 years, and most of what I hear about my work is what I did wrong. I know that's how training is supposed to work. But—" He stopped again. "It made a difference, what you said." She looked at him in the cold parking lot light. A second-year resident who was tired and who had done something honest and difficult in the last 36 hours, and who was still young enough to need to hear that it mattered. "You have good instincts," she said. "Protect them. The system will try to train them out of you. Don't let it." He held her gaze for a moment. Then he nodded, a real nod, not a social gesture, and walked to his car. She watched him go. Then she walked to hers. The drive out of the hospital parking lot took her past the ambulance bay, past the administrative corridor windows still lit from the investigation's aftermath, past the emergency entrance where 2 days ago she had watched the Blackhawks downwash make the flags horizontal and snap. She took the road out of the hospital campus and onto the main street of Harrow Falls, which was quiet at this hour, the kind of quiet that small towns generate after 9 p.m. Everything closed and still, and the mountains present in the darkness like a fact that doesn't need to be stated. She drove without music. She usually did. She was thinking about a thing she'd understood a long time ago and had let herself partially forget in the grinding institutional reality of 8 months in a place that was working to make her smaller, that the work of medicine, done honestly, is an argument against indifference. Every accurate chart is an argument against indifference. Every patient who survives because someone paid attention is an argument against the idea that it doesn't matter what you do or how carefully you do it. Every protocol built with integrity instead of convenience is an argument against the comfortable fiction that systems take care of themselves. She had walked into a building in the middle of a night when someone with a severed arm might have died, and she had seen what needed to be seen, and she had refused to look away. That was the whole of it. When you stripped away everything else. It was not heroic. Heroic was a word she distrusted because it implied exceptionalism, and what she believed, what her experience had rebuilt her beliefs around, was that the capacity to do what she had done was not exceptional. It was available to any person willing to pay the cost of developing it, which was real and high, and mostly invisible. The cost was not the training, though training was real. The cost was the sustained choice, daily, sometimes hourly, to be honest about what you saw even when what you saw was inconvenient, to write it down correctly, to stay in the building when the building had told you to leave, because there was a patient in Bay 1 and you'd said you would be there, and that meant something to you regardless of what it meant to anyone else. Most people who did this work understood that. She wasn't special for understanding it. She was just unwilling to stop acting on it. She drove through Harrow Falls and out the other side, toward the small apartment she'd lived in for 8 months without much personalizing it. A habit from years of moving, a reluctance to put things on walls that would just have to come down. And she thought that tomorrow she might buy a plant. Something small, low maintenance, the kind that didn't require much and didn't ask for anything except to be left in a window with some light. A small enough thing. A start.